we actually have the opportunity to provide people with something that is cohesive and accurate. You want to test this person on this hand scale, you want to give them this course? We've got cameras in the room, you can tap in live and watch. We can record everything, we can save it for you. We can show you how they performed, we can show you how they graded out. We can show you how they scored on a didactic lecture. Anything you really want to set up, but don't you want, as a dental board, don't you want the opportunity to know that if you're putting a sanction on someone for a reason, that you can prove that person has actually overcome that challenge before you put them back in practice to work on patients. That's your job as a dental board member, is to protect the public. And our job is to make sure we're making that as accurate as possible to help the dentist primarily, but also to help the board make sure that they are putting people back in licensed roles that can really help the public.
It's all the practice you want. I mean, you can repeat procedures over and over. You get instant feedback on how you're doing so that you see, okay, here's where I need to improve, here's where I need to get better. But if I was the dentist being recertified, I would want to know that it was objective and it wasn't just somebody saying, no, I don't like the clothes you're wearing today, so you didn't do too good. What you do is what you're going to get. And that also, if I'm on the other side of that, if I'm on the board that's looking to see if this person can go back into practice, boards want people in practice. They want people to practice. But their job is also to protect the public, and so they have an objective way of knowing that the public's being protected.
One of the more difficult responsibilities of a dental state board is to react and respond to complaints from patients across their state. So the state board investigates these things, and when they determine that there is some cause for concern, they have to address that with the dentist, the dentist that is in charge with that. Prior to this, and again, as you mentioned, as a result of COVID, it has been really difficult for the state boards to address these problems. And one of the things that we can do in a very COVID-safe environment is to create courses specific to the need of the individual, thus satisfying the state's complaint. And we can also report on the results of the courses that we submit, that we administer for the participants, on the improvement, on the status of the individual. And when necessary, report that there was no improvement or that the standard of care has not been met. So the issue is, again, what is the infraction? What is the proper action for the infraction? And then creating a course that addresses that appropriately.